After years of planning, funding, and calls for harm reduction, Manitoba's mobile overdose prevention site is finally here.
We have a smoking tent available, and then we also have the RV itself where people can do the things they need to do inside of there.
The 26-foot mobile site was launched by Sunshine House, a community center focusing on harm reduction and social inclusion. Funded by the federal government, the RV provides harm reduction services 5 to 6 nights per week to people who use drugs in Winnipeg's Central, West End, North End, and Point Douglas communities.
In the event that a person has a adverse reaction to the drug they're using, there's somebody there to intervene immediately and potentially save their lives.
Manitoba has seen a spike of overdose deaths during the pandemic. Just last year, more than 400 people died from a drug overdose. That's doubled compared to the numbers in 2020.
There's two reasons why we're seeing more and more deaths by IV drug users. One is actual overdose, which is occurring all over the place in increasing numbers. But the other issue is poison supply.
Foy says that the mobile site is a safe space for people who use drugs, but its primary goal is to gather information on the people who use these services so that they can provide even better services in the future.
So one of the primary goals of this mobile overdose prevention site is to really get a robust data set on things like the percentage of what percentage of toxic drug supply are we dealing with, the amount of people who would use a service like this, what kinds of things are people looking for outside of this type of stuff.
Health Canada provided almost $400,000 for the project, but Foy says that still won't be enough for the long run.
If we were to look at expanding into evenings, going into different neighborhoods, having multiple vehicles, maybe, we definitely wouldn't have that. We wouldn't have enough money for that kind of stuff.
Mayoral-elect Scott Gillingham has made it clear that overdose prevention sites are not the responsibility of the city. In a statement to City News, a spokesperson for Gillingham writes, he's open to the idea of a supervised consumption site, but he feels the province should take the lead in providing funding or staffing to support a site like this, as it is healthcare. But advocates say addressing issues like this requires effort from everyone.
It begs the issue that we need to get all three levels of government together with service providers, with people with lived experience and the families. We got to get those folks together and really establish what's really the best course of action.
In Winnipeg, Sweet Arasi, City News.
In 1 minute.